everyone. We are thrilled to welcome you to the next episode of Concorde Conversations. This is a new initiative by Concorde Medical Group to educate, empower, and encourage our community to improve their health so we can all live to our fullest potential. We are so excited today. We have a great discussion planned for you. It's Put Your Best Face Forward. It's a discussion about acne and acne scars. Hi, I'm Dr. Catherine Weinberg, and I'm joined today by two outstanding and brilliant dermatologists. We have our returning guest, dermatologist Dr. Blochin, and introducing our most amazing dermatologist, Dr. Maryles. We are excited you are here. You will have already sent in excellent questions, which we will be discussing today. If you have any additional questions, please ask them in the chat box. We only have 30 minutes together, so we will try to go through as many as we can. We are giving general guidance. If you have a particular question about your health, we'd like to answer you. We'd like to help you. So come in for an appointment so we can answer your question and give your health the attention it deserves. So let's begin.
I would start seeing a dermatologist for acne as soon as it's starting to bother you, truthfully. I mean, you can use over-the-counter products, and sometimes they can be helpful. Oftentimes, patients don't even know which over-the-counter products to use. They start to use too many products, and then we have even more problems. And even with like mild acne, sometimes it can lead to scarring. So the earlier the intervention, I think, the better.
I completely agree with that. And I wanted to add that there are a lot of companies now that are online and they promise the individualized attention, the customized, plan, protocol. You send them the description of your acne, you send them a photograph, and then they come up with this regimen. It doesn't work. And I've seen a couple of patients and the regimens they come up with that are not helpful and can be hurtful. Well, to the point that Dr. Maryles made, the most important thing is to prevent scarring because it's much easier to prevent it than to treat it.
So I think that the way to prevent acne is the same way that you prevent acne in general. I mean, unfortunately, we have to wear these masks, and they do occlude our pores, and they do make you a little bit more prone to getting acne, and that's just inevitable no matter what we do. First and foremost, everyone has to wash their face morning and night. It doesn't have to be with an aggressive cleanser, but it just needs to be, you got to get all the dirt and grime off from the day. You want to put on only oil-free moisturizers or any oil-free products on your face in general, because if anything is greasy and then you occlude it with the mask, you're definitely going to get acne from that as well. And then just generally, and I think we're going to go into that further, treating acne, just maskne and acne all are kind of one and the same.
For a lot of people, that's the case, but unfortunately not for everybody.
Men tend to grow out of acne a little bit more than the women, because women, unfortunately, with our hormones, they're like fluctuating throughout the entire life. So as they fluctuate, sometimes girls who didn't have acne as teenagers, they develop acne in their 20s and 30s, and they're usually pretty upset because they thought they're too old to start having acne. And unfortunately, that's not the case.
There is definitely some correlation, but the studies have never shown really hard data to suggest any sort of dietary modifications. But there's definitely correlation between high glycemic index products and also oily and high fat diet that can definitely make the acne worse.
A lot of dairy, specifically like fat-free dairy, that's the only thing that has the best evidence, I think, now that it may contribute to acne. Having said that, I think, you can tell patients to take dairy completely out of their diet, and oftentimes their acne doesn't get better. Same thing with the high sugar, white flour diet, that kind of diet, you take that away, very often people still have acne. There's a strong genetic and hormonal component, and no matter what you do or what you eat, you still get acne.
All right. What about drinking a lot of water? Does that help?
It helps with a lot of things, but not with the skin, okay. Not as much, and definitely not with acne.
But avoiding processed foods and lots of sugar helps your heart, so stay away from it, right?
think just gentle cleansers are the best cleansers to use on your face. But I even say to patients that if they're really lazy at night and they don't feel like washing their face, which is sometimes how I feel, at least using one of those like makeup wipes or the Neutrogena face wipes to at least get the grime and oil off your skin. It's really the oils that build up on your skin during the day. If you go to bed with that overnight, there's a good chance that you're gonna contribute to the acne that you're gonna get in the following days. So I like to use cleansers that are not irritating and not too drying to the skin. So, there are a lot of cleansers that have salicylic acid and benzoyl peroxide, and those can be helpful, especially, and I think we're going to talk about this further, for the trunk, so for the chest or back acne, where the skin is a little bit hardier and able to tolerate those harsher chemicals. But on the face, if I treat you for acne and I give you something to like a gel or something else to put on your face, and you're using the salicylic acid washes, it becomes too drying, and then we're just chasing our tail between having acne and oily skin and then really dry, flaky skin. So gentle cleansers, I think, are the way to go.
I agree completely. And I also tell my patients to just use their hands, without scrubbing, without pom-poms, and
Right.
not to do the exfoliation. The principle to remember is that if you over dry the skin, then the skin starts to overcompensate and it becomes even more oily. If you want to use the moisturizer and you want to use the sunscreen, in a way it becomes more important even to use a sunscreen when you do have acne, because once you're done with an acne spot, you still have a remnant in the form of a red spot, and that red spot is going to stay there longer if you don't protect it from the sun. So you want to protect it from the sun, but you have to look for something that's called non-comedogenic, so something that would not clog the pores.
You have to take the patient into the whole face into account. Some patients who tend to be really, really dry, we try to avoid some of the more drying agents, or we also try to use them only, let's say, a couple times a week. So for example, retinoids such as tretinoin or Retin-A is a great treatment for acne. It prevents acne, it helps heal up scarring from acne, it also helps treat wrinkles. So like everyone needs to use it, but the problem is it's really drying. What I try to tell patients to do, what we both try to tell patients to do, is to put it on maybe only, let's say, 2 nights a week. You can put an oil-free or non-comedogenic moisturizer on top of it. And then the rest of the nights of the week, you're also going to be moisturizing with an oil-free moisturizer. And again, in the morning, after you wash your face, you need to, once again, use a moisturizer that's oil-free and also has a sunscreen in it, because many of these products that we use to treat acne do also make you sensitive to the sun. And as dermatologists, we also recommend sunscreen every day.
Acne can be divided into by location. It can be just the face. It can be also on the chest, on the back. Acne that's on the trunk, on the chest, especially on the back, tends to be a little bit more resistant to treatment. So you need to pay special attention to that. Acne can also look different. So some people are confused when they just see the white little bumps. They think that it's not acne. It actually is. It's also part of acne. Acne can form the painful cysts that we commonly see here on the jaws. That's all of it is acne.
One viewer had a question. She said, as a senior, I have tiny little bumps on my neck and my chest and a few on my face. Are these considered acne? And is there anything that can be done to get rid of these and prevent these from occurring?
So I don't exactly know what the little bumps look like, so I can't say for sure.
Yeah.
But there are different types of acne on the chest and back. Usually there's little bumps, like little tiny cysts that get stuck under the skin, or they could be just regular little red, more follicular acne, or acne that's around the hair follicles. Both of them can be treated. I mean, typically we treat them with both, depending how many you have and how bad the acne is, with both oral antibiotics at times, but definitely with topical combination products, typically, that have both a topical antibiotic and a Retin-A product, so that the bumps kind of come to the surface with the Retin-A product.
over-the-counter remedies can be helpful if you have mild acne. And again, like Dr. Maryles said, even mild acne, if it's persistent and if you're picking on it, it can still leave pretty bad scars. So just because it's mild, don't be fooled that you can treat it on your own. I think at maximum, you should give it a couple of months. And if it doesn't go away within 2 months with self-treatment, then you should schedule an appointment. Products that can be helpful that are over the counter would be acne cleansers, ones that would have salicylic acid or benzoyl peroxide. And again, you have to be very careful with those products because they can be irritating and drying. There are two more products on the market that do have a type of a retinol. One is called Different, and the other one is Effaclar from La Roche-Posay. They can also be tried, but again, you have to know how to use it and when to use it, and different types of acne are amenable to different types of treatment.
So this is controversial. I won't say 100% no. You have to know what you're doing and how to do it. And the problem is sometimes patients, and myself included, get very aggressive with themselves, and then we lead to like more scarring and more trouble than we started with. If the pimple is a real true whitehead that's literally sticking up on the surface, you can take, you can clean a little tip of a needle, poke it, and then I say to take 2 Q-tips and press gently on the side, not your fingers, the Q-tips, and it'll express and come out pretty quickly. That's about as far as I go. Otherwise, you really need sometimes, like I need to open it with a blade. Sometimes you think that there's a really deep pimple and you feel like there's something in there, but there's really nothing that's going to come to the surface. And in that case, the best thing to do is either just leave it alone and let it sit, and it will go away with whatever treatments that I've given you. Or also you can come in for an injection of a steroid, which is an anti-inflammatory and reduces the inflammation and shrinks it down much more quickly so that you're less likely to play with it. And also you feel a little bit better because it goes away within a day or two instead of a week or two.
And it depends on what kind of acne you come with. If it's severe, persistent acne, and we already see that the scarring process has started, we're going to be more aggressive, and we'll start with some oral medications. And there are different options. There are antibiotics, there's Accutane, and in women there's another medication that's called Spironolactone, which works really great in a specific population. If the acne is more mild and if there's no scarring, we have a little bit more time on our hands to sort of experiment and see what works. Then I would still start with topical medications and give it about 2 months and see what happens. Unfortunately, it's a trial and error because some medications can be more effective for some patients than others, but the prescription strength medications that are available to us are a lot more effective than over-the-counter stuff.
Accutane is an amazing medication, and it's one of my favorite medications because it actually works and it makes me feel good because I can make people's acne go away. Not everyone needs Accutane necessarily. Not everyone has the type of acne that requires Accutane. I mean, typically with Accutane, it's either the patient is really like just so upset about their acne and we've tried the other medications and they're not working, or they have cystic acne, which really can lead to like significant scarring, and the only way we can really stop the scarring and stop the acne is with Accutane. Accutane is really just basically high dose vitamin A. It's retin A basically in a pill form. It does cause birth defects. So for women, and only women of childbearing potential, you cannot get pregnant. You cannot get pregnant while you're on Accutane. You need to use 2 forms of birth control. If you do get pregnant, you have to have an abortion. The baby can have birth defects. But 1 month after you're finished with the Accutane, you can have as many babies as you'd like, and there are no long-term effects. And the government made a federally regulated program where we have to input every single month a patient's urine pregnancy test or blood test to make sure and to prove that they're not pregnant.
And even though men cannot get pregnant, it applies to men as well. So
Got it.
they have to go through the same program, unfortunately.
Oh, okay.
Yeah, it's pretty safe medication and it gets a bad rap out there on the internet, but it works wonderfully. And the truth of the matter is that on a daily basis, the side effects really are dry lips. So I can usually tell just by walking around in a high school who's on Accutane. Dry lips, dry skin. And I tell patients you can't wax during that period of time. You can thread your eyebrows, but you can't wax. And you can't really go into the sun very much. Alcohol wise, I tell patients really don't overdo it. Listen, Accutane and alcohol are both metabolized through the liver. So when you take a lot of them both at the same time, you're competing with each other and it's not good for your liver. Having a drink or two is probably okay. Getting drunk regularly is not.
We do blood work a month before we start the medication just to make sure that baseline, the liver is functioning well, the blood counts are well. And then we do another set of blood work 2 months after starting the medication. And if everything is within normal limits, that would be it. That's an interesting question because there are some forms of birth control that can be very helpful in acne. And then there's some forms of birth control that can be not so helpful and can make your acne worse. So if you plan to start birth control, you should definitely talk to your gynecologist and discuss that issue before starting the birth control.
Right. I do find that a lot of patients who have IUDs in place, at the beginning it might not affect your acne, but at some point patients do get acne because most of the IUDs that people have only have progesterone in it, and you really need the estrogen mixed with the progesterone to sort of level out the hormones to help with any preventing acne. So IUDs, for patients who don't have issues with acne, it's fine, but I do find that that's one of the types of birth controls that can be a real issue. Spironolactone is amazing for female hormonally driven acne. So most females over the age of 20 are having hormonally driven acne. Typically, it's like literally in this area, more of the jawline, but you can also have it on your chest and your back as well. Spironolactone basically blocks the male androgens or the male hormones that are in all of our female bodies. When you take it, it doesn't affect your estrogens or progesterones, but it does sometimes make your menstrual cycle a little bit atypical. Many of my patients on spironolactone are on birth control as well, so that doesn't become much of an issue. Lab-wise, really, under the age of 45, I really don't draw any labs at all. It used to be that we were very concerned about potassium levels, and I drew them every single time I saw them, and I never had a single weird atypical potassium level ever. So I think a lot of dermatologists saw this over the years, and so we kind of changed our tune. I usually draw it 1 month after I start a new dose, anybody over the age of 45. And then we do it every 6 months. I do like a potassium. But again, I never see atypical potassium levels, so there's probably almost no point to it anyway.
I don't do it. I didn't do labs at all.
All right. Well, when I use it for heart failure, it's heart failure medication. We draw labs. And
well, you have a lot of other
things
going on there, yeah.
But if you have healthy kidneys, then
it works beautifully.
Talked in the beginning, the major issue with acne is the scarring. And scars are irreversible. We can treat them, we can try to make them better, but obviously we're not going to get the skin to its condition before the scars develop. There are different types of acne scars. So
we can see it.
You can see it.
Yeah.
So they're the ones that are called the ice pick scars. They're just this very deep but narrow indentations. They're rolling scars that are a little bit more wide but not as deep. And they're boxcar scars that are sort of like a box shape, like a box scar. Ice pick scars are treated best with a very concentrated acid, and the way it's done is the acid is applied to the base of the scar, and it basically destroys the skin here, stimulating the regeneration of the epidermis. It doesn't happen overnight. It doesn't happen with one treatment, but with a couple of sessions, it slowly fills up the skin to where the surface is almost completely leveled with the surrounding skin. The rolling scars are a little bit different because the reason that they are indented here, that the skin is indented here, is because of the fibrous strands that hold it deeper to the skin. So the way we treat these scars is by putting a needle, a special needle that cuts these strands, allowing the skin to sort of pop up. And you can see how it does it at the time of the procedure.
Oh,
It
wow.
comes up.
So it's pretty immediate, the effect then.
It's pretty immediately. The recovery period is going to be about 2 weeks maybe because this does bruise. You're creating trauma. But the effect is pretty astonishing and pretty immediate. Back scars can be a little bit tricky. You know, sometimes when they're wide like that, they can be surgically removed, and then the edges of the skin can be put together, eliminating that scar. Or they can also be treated with this subcision. This is called a subcision, with the subcision procedures. And then there are other devices that are on the market. There are a couple of them, which we have. We have all of them. Some of them.
You have all kinds of fun technology.
Yeah, I think we have the best one. So there's fractional microneedling, and then there's these are the big ones. So fractional microneedling and fractional laser resurfacing. The one that we have is called fractional plasma radio frequency. The big advantage of that one is that the small channels that are made in the skin are extremely superficial. So we're talking all of this is just the surface of the skin. So we're not damaging as much the skin, but then the sort of the stimulation of the skin goes much deeper.
Oh, wow.
Than the surface. So and that's how we stimulate the collagen, and the collagen stimulation evens out the skin surface.
Right, and it also helps with tone, texture, wrinkles, all that stuff as well.
And it's not a needle; it's just a roller.
Right.
And just to show you, to demonstrate what it looks like, the recovery period looks like, I had it done on myself 2 days ago.
I think your skin looks great.
I did too. They did do a study where they compared it to an ablative laser or CO2 laser that is very aggressive for acne scarring, and they got the same results.
Oh, wow.
Except that the recovery period was much better, as you can tell.
The first step is probably to wash your face morning and night and use oil-free moisturizers with the sunscreen in the morning. That's the most important thing. It's not going to necessarily prevent all your acne. There's a very good chance you're still going to have acne and need to see one of us. But you need to start washing your face. That's usually what I say to my teenage boys when they come in and they say to me, what can I do for my acne? The first thing I say is, do you wash your face? And usually the answer is no. And I have 2 teenage boys at home and they never wash their face. So that's the first step. And then, of course, sunscreen and of making sure that it's oil-free as well.
Got it.
And for me, I would say that if you have an issue, even if it's a minor issue, and you don't think it's a big problem, just come in for a consultation. It's always better to start early so that you can prevent the consequences, because it's a lot harder to deal with the consequences.
Got it. Any last comments? Any last thoughts for our viewers?
We have some really good treatments out there, and the truth of the matter is that there's literally a new topical treatment coming out every day. I think in the last few months, 3 new topical treatments, both that work for hormonally driven acne and just typical acne, have come out on the market. So there's really a lot of options for people, and as we like to say, you don't have to suffer at home with terrible acne and be embarrassed and all that. We can treat it, and we can treat it pretty effectively.
And same is true for scarring. We're not going to make it perfect, but we're going to make it much better.
Right. Yes. Well, that's great. Well, thank you everyone for joining us for another inspirational and educational episode of Concorde Conversations. We know many of you have additional questions and we'd like to help you. So come in for an appointment. We care about you. We care about your health. And so thank you for listening today.
Thank you.
Thank you.